This PowerPoint contains few questions with answer, and this question collected from the previous year questions. It will be repeated again in your exam. This question for all new graduate, retaker, and also the foreign medical doctor or for the nurses. First question here, which vaccines should a nurse carry as a client with chronic obstructive pulmonary disease, shortly called COPD, to receive? So chronic obstructive pulmonary disease, also known as COPD, right? Or we call chronic obstructive lung disease. And COPD is a common, preventable, treatable disease that is characterized by persistent respiratory symptoms like progressive shortness of breath or cough. So if my patient has COPD, we need vaccine. So which one they should take? Varicella, influenza, hepatitis B, and human papillomavirus. Which one? Correct answer is influenza, right? So varicella we give for chickenpox, hepatitis for liver disease, and human papillomavirus, it is for STI. So the reassurance say clients with COPD are more susceptible to respiratory infection, so that should be encouraged to receive influenza and pneumococcal vaccine. The client with COPD are not at the risk for varicella or hepatitis B. And human papillomavirus vaccine is to guard against cervical cancer and is recommended only for women aged 9 to 26 years old. In this table, we can see a list of vaccine names like TD or TTAP, right? T for tetanus, D for diphtheria, P for pertussis, DTAP or TTAP. So tetanus for tetanus toxoid, diphtheria for whooping cough or pertussis. Human papillomavirus we give for, you see, to prevent against cervical cancer. Measles, mumps, rubella. These three vaccines together called MMR. We prevent the measles and mumps. Varicella for chickenpox, influenza for flu, pneumococcal, it is can prevent pneumonia. Hepatitis A, hepatitis B can prevent hepatitis, and also meningococcal vaccine can prevent meningitis. Question: a nurse is assessing a client who comes to the clinic for care. Which findings in this client suggest for bacterial pneumonia? Number one, non-productive cough and normal temperature. Sore throat, abdominal pain. Number three, hemoptysis and dysuria. Number four, dyspnea and wheezing. So your patient diagnosed pneumonia and the underlying cause is bacteria. So pneumonia is an infection of the air sac or infection of the lungs in one or both of the lungs, characterized by severe cough with some excess secretion, like patient present with a fever, chill, and also difficulties of breathing, whatever it is. They said, which findings? The clients suggest bacterial pneumonia means signs and symptoms of bacterial pneumonia. So correct answer is shortness of breath called dyspnea or wheezing. Other common sign of pneumonia may be present with dry cough, abdominal pain, cold in the head or throat, muscle ache, fever, chest pain, and nausea and vomiting. Rational said, in a client with bacterial pneumonia, retain secretion that cause dyspnea. Also, respiratory tract inflammation causes wheezing. Bacterial pneumonia also produces a productive cough and fever, rather than a non-productive cough and normal temperature. Sore throat occurs in pharyngitis, means inflammation of the pharynx, not in the bacterial pneumonia. Abdominal pain is characteristics of GI disorder, unlike the chest pain, which can reflect a respiratory infection such as pneumonia. Hemoptysis, right, means cough with blood, or dysuria are not associated with pneumonia. Most common sign of pneumonia is cough with mucus, fever usually of high grade with chills, fast breathing means tachycardia, shortness of breath, chest pain, fast heartbeat, feeling very tired or very weak. Sometimes patient complain nausea and vomiting, diarrhea or loss of appetite, body ache, common sign of pneumonia. In this phase, we can say very funny way to remember the signs symptoms of pneumonia. Let me read one more time. They said obstruction of bronchioles and decrease the gas exchange capabilities, increase exudate, means secretion accumulate in lung alveoli, and gas exchange capacity reduce, less oxygen in body, more carbon dioxide accumulate and causes the symptom. What it is? Maybe cough, body temperature raise 102 degree, productive cough, it might be yellow, blood mixed, rusty sputum, indicate infection. Sometimes opportunistic infection as well. Most common symptom cough, fever, chill, tachycardia, tachypnea, increased heart rate, increased pulse rate, dyspnea, shortness of breath, pleural pain, chest pain, malaise, respiratory distress also, decreased breath sound. What next? Here I left few information about aspiration pneumonia. Aspiration pneumonia, also known as pulmonary aspiration. Aspiration pneumonia, a condition in which food or stomach content or fluid are breathed into the lungs through the upper respiratory tract. This results in cough, shortness of breath, wheezing, and in severe cases, and choking. It is life-threatening condition. So aspiration pneumonia can be avoided if the patient has a compromised airway, like stroke patient or one who is unconscious, A foreign substance such as stomach content or emesis, means vomitus, may enter the lungs and keeping the head of the bed up to 30 degrees or is ordered by doctors. Very important. And it can prevent this happening. Check for residual as ordered. We will prevent the stomach from becoming full to full and possible vomiting. So care of plan. So the care of plan for patient with airway compromise, patient for special pneumonia, maintain patient airway, follow up doctor's order, head of the bed up to 30 degrees, and educate the family not to lower head of the bed. Important for our NCLEX exam. Next question here. A client with impaired gas exchange, which position is the best? Lateral decubitus, high polar, supine, and semipolar. Correct answer is high polar. So why it is the answer? Rational said for a client with impaired gas exchange, high polar position is the best position because it allows maximal chest expansion. If the client cannot tolerate high polar position, semipolar is the next best choice because it increases comfort and allows the chest expansion. The lateral decubitus and supine position do not promote the chest expansion. So in this picture, we can see this one is prone position. So prone position means the patient, someone in the prone position is lying face down, means patient lie on abdomen. The next one here, supine position. So someone in the supine position is lying on his or her back. So lie down on back position. We can see here right lateral recumbent position, and this one is the left lateral recumbent positions. So right lateral recumbent position, the right lateral recumbent, or shortly called RLR, means that the patient is lying on the right side. And the left one means the patient is lying down on their left side. Polar position like this, a person on polar position is sitting straight up or they lean slightly back, right? And their legs may either be straight or back. And this position is called Candelbach position, right? So the person in Candelbach position is lying supine with their head slightly lower. Usually, if the need the subject to the brain like shock, we allow them Candelbach position. Next question here. A nurse is planning care for a client after a tracheostomy. One of the client's goals is to overcome verbal communication impairment. Which intervention should the nurse include in the care plan? Number A, make an effort to read the client's lips to foster communications. 2, encourage the client communication attempt by allowing him times to select or write words. Number 3, answer questions for the client to reduce his frustrations. Number 4, avoid using a tracheostomy plug between it blocks the airway. So correct answer is number 2. Encourage the client communication attempt by allowing him time to select or write words. In this picture, we can see a tracheostomy. So a tracheostomy, also known as a tracheotomy or tracheotomy. So it is a small surgical opening that is made through the front of the neck into the trachea. So it is a carved plastic tube. You see the plastic tube is a tracheostomy tube. Is placed through the hole, allowing the air to flow in and out of the windpipe. Definitely, this tube does not extend into the lungs. So, as a healthcare provider, it is very important to know how to take care of that tracheostomy tube. So, first of all, rationale: the nurse should allow ample the time for client to respond and should not speak for him. And she should use as many aids as possible to assist the client with communication and encourage the client when attempt to communicate. When the client is ready, the nurse can use a tracheostomy plug to facilitate the speech, making an effort to read the client's lips and answer the question for the client are inappropriate. This is the box or table we can see how to take care of tracheostomy. Easy way to remember: TRACHEA, trachea. T stands for TAP, R stands for rescue, A stands for airway clearance, C stands for care of the site, A stands for humidity, and E stands for emergency boxes. Let me explain a little bit. T stands for keep the tube secure. R stands for known the resuscitation procedure. A for airway clearance, use the correct suction techniques. Very important. Also, care of the site means trauma and neck. Essential to keep the tube clear and maintain humidity. And also, E for emergency box supposed to be there. So have the box always be ready on the patient bedside. Next question here. A nurse is caring for a client with a chest trauma. Which nursing diagnosis takes the highest priorities? So the key point is here the chest trauma. So chest trauma can lead to severe, serious, and potentially life-threatening injuries. So as a generalities, the chest traumas patient present with chest pain and shortness of breath, and it is life-threatening. So which is the most priorities? Impaired gas exchange, anxiety, decreased cardiac output, and ineffective tissue perfusion. Correct answer said impaired gas exchange. So rationale: for a client with chest trauma, A diagnosis of impaired gas exchange takes the priority because adequate gas exchange is essential for survival. Although the other nursing diagnoses like anxiety, decreased cardiac output, ineffective tissue perfusion are possible for this client, they are lower priority than impaired gas exchange. Is the first priorities. Next question about tuberculosis. A client who has started therapy for drug-resistant tuberculosis, demonstrate understanding for tuberculosis transmission when he said, so tuberculosis, it is a contagious. It can spread one to one, person to person. Contagious infection caused by bacteria that is mainly affect the lungs, but can also affect in other organs, include bones, brain, spine, even kidney. But the lungs is the most common. So out of four, which statement indicate patient can understand? Number one, my tuberculosis is not contagious after I take medication for 24 hours. Absolutely wrong. I'm clear when my chest x-ray is negative. Number three, I am contagious as long as I have night sweat. Number four, I will stop being contagious when I have a negative acid fast bacilli test. So answer is I will stop being contagious when I have negative acid fast bacilli test. Rational said a client with drug resistant tuberculosis is not contagious when he had a negative acid fast test. A client with non-resistant tuberculosis is no longer considered contagious when he shows clinical evidence of decreased infections, such as significant decreased coughing, fewer organisms on sputum smear. The medication may not produce negative acid fast test result for several days. The client would not have a clear chest x-ray for several months after starting treatment. Night sweat are a site of tuberculosis, but they do not indicate whether the client is contagious. Here we can see the signs symptoms of tuberculosis according to the CDC. So the symptom of tuberculosis or TB disease depends on whether in the body of TB bacteria are growing. TB bacteria usually grow in the lungs. It is called pulmonary TB. TB disease in the lungs may cause the symptoms such as a bad cough that lasts more than 3 weeks or longer, pain in the chest, coughing up blood, or postpartum. Other symptoms: weakness, feeling fatigue, weight loss, no appetite, chill, fever, and sweating at night. Very important for NCLEX board. Now question, how we care of the patient who have tuberculosis, nursing intervention. So health promotion means we have to evaluate who have TB or who have not. So if you have a TB, it is important to stop the interaction with the public. right? So acute intervention, airborne isolation. So what kind of precursor we need? Airborne, medical workup, and also drug therapy. There are three drugs we use: patient education about the disease, about the medication side effect. Also, ambulatories and home care. Compliance is very important, and don't maybe incorporate it. Follow-up visit, patient education, and about reactivation the factor of the disease, like immunocompromised. So if a patient have a HIV or organ transplant, so they are immunocompromised. If patient have a cancer, if patient under chemotherapy, they have a chance to develop tuberculosis. Next question here. For a client with chronic obstructive pulmonary disease, which nursing intervention helped maintain a patient airway? A, restriction fluid intake to 1000 ml per day, enforcing absolute bed rest, teaching the client how to perform, control the coughing, administer ordered and sedative regularly and in the large. So the COPD, right? So first of all, if a patient has a COPD, obstructive pulmonary disease, we diagnose, involve the test, evaluate the condition of the lungs and assess the severity of disease. So which intervention help to maintain patient airway? The correct answer is educate or teaching the client how to perform, control the coughing, right? So first of all, treatment aim at managing the condition and delaying progress through the medication, physical therapy, and also educate the patient. And finally, severe cases need surgical management. Rational said controlled coughing helps maintain a patent airway by helping to mobilize and remove the secretion. A moderate food intake and moderate activity help liquefy and mobilize secretion. Bed rest and sedation may limit the client's ability to maintain patient's patent airway and causing the high risks of infection for prolonged secretion. So first of all, we have to know how to care of the patient who have COPD. So nursing care for COPD patient is important, right? So caring of COPD patient, if you have COPD care, if the patient has COPD, care in a patient-centric medical include behavioral therapy conducted by care coordinators, right? And they will help the patient see what you can do to positively affect the patient health. So next question here about the cystic fibrosis. So an adult client with cystic fibrosis is admitted to an acute care facility with acute respiratory infections. Ordered respiratory treatment include chest physiotherapy. Which should the nurse perform this procedure? Number one, immediately before a meal, at the bedtime. Number three, when bronchospasm occur, and number 4, when secretion have mobilized. So question cystic fibrosis, right? The correct answer is at the bedtime. If this is the trachea, lungs, and this is normal healthy trachea, smooth muscle, tracheal muscle, lungs or lumen. But in cystic fibrosis, we see the inflammation, thickening the smooth muscle, narrow the lumen, increase the mucus secretion. So the nurse should perform chest physiotherapy at bedtime to reduce secretion in the client's lungs during the night. Performing it immediately before a meal may try the client and impair the ability to eat. Patient feel fatigue or tired. Percussion and vibration component of the chest physiotherapy may worsen bronchospasm. Therefore, the produce is contraindicated in the client with bronchospasm. Secretion that have mobilized are a contraindicated for postural drainage, another component of chest physiotherapy. So here we can see some basic information about cystic fibrosis. Cystic fibrosis, it is autosomal recessive disorder. It is a genetic disorder in which the lungs and digestive system get excess secretion blocking with mucus, right? Abnormal gene, and this abnormal gene affect the chromosome number 7, and which is produced CFTR, means cystic fibrosis gene, cystic fibrosis transmembrane regulatory gene defect. Most common symptom here, failure to thrive, if in case of baby, malabsorption, recurrent chest infection, infertility in men, pneumothorax, diabetes, meconium ileus, bronchiectasis, steatorrhea, mixed fat, depression, hemoptysis, productive cough, pneumonia, and nasal polyp. CFTR, this is the effective protein, cystic fibrosis transmembrane regulator protein. It is absence gives increase the viscosity of secretion, also affect the inflammatory process and immune response. So most common easy tests are sweat test. Sweating induced by pilocarpine, sweat collect and positive if sodium chloride concentration more than 60, right? So the treatment therapy increase the life expectancy. Annual review, physiotherapy can help, regular lab test, counseling, genetic therapy, diet, right? Also vitamin supplement. Here we go little bit review about cystic fibrosis. They said most common symptoms are feeling fatigue, chronic cough, recurrent upper respiratory infection, thick sticky mucus, chronic hypoxia. So too much secretion in the respiratory tract, and it is very thick, easily stuck, and then they can narrow this pathway and bacteria easily get stuck and multiplications. Also decrease the absorptions of vitamins and enzyme, abdominal distension, decrease the digestive enzyme, and also rectal prolapse, fatty sticky stool we call steatorrhea. The treatment purpose: diet, increase calorie, increase protein, pulmonary therapy, physiotherapy is important, chest physiotherapy, postural drainage, breathing exercise, also medication like antibiotics, supplement vitamins, bronchodilators, mucolytics, and also pancreatic enzymes, because it is a genetic defect where the lungs get involved, digestive system get involved. And what else? The nursing care for cystic fibrosis. So general hygiene care should be given to diaper area. Frequent change of posture will help to prevent development of pneumonia. Also, child wear a light clothing to prevent overheating. Long-term care goal include minimize the pulmonary complications, ensure adequate nutrition, promoting growth and development, and also assist family to adjust the chronic care. So first of all of these questions is important for your NCLEX exam. If you practice, I believe it help you to pass your licensing board. So always keep in mind, you can, you will, and you must pass your NCLEX board if you practice this series of questions.